Breaking the anxiety cycle, psychological mistakes that sabotage erections. Erections are as much a product of the mind as they are of blood vessels and hormones. When anxiety enters the bedroom, the sympathetic fight-or-flight response floods the bloodstream with adrenaline, redirecting blood away from the penis and making it difficult to achieve or maintain an erection. A sex therapist described 3 common mental mistakes men make when they lose their erection: doing a pre-flight check, speeding up when things fade, and constantly monitoring performance. The pre-flight check happens when a man starts anticipating failure before sexual activity even begins. He may check whether he is hard or worry about how long he will last. These thoughts trigger anxiety, and anxiety triggers adrenaline, constricting blood vessels and shutting down erections. Similarly, if an erection starts to fade, many men instinctively speed up thrusting in an attempt to outrun the problem. This only escalates the sympathetic response. Finally, obsessing about performance. Am I hard enough? Is she enjoying this? Diverts attention away from pleasure and into self-criticism. The brain reads this stress as danger and withdraws blood flow from the penis. A physiological explanation supports these observations. The autonomic nervous system has 2 branches: the parasympathetic system, rest and digest, which facilitates erections, and the sympathetic system, fight or flight, which inhibits them. When you feel relaxed, nitric oxide is released in penile tissues and blood vessels expand. Anxiety flips the switch, sending blood to muscles rather than to the genitals. In other words, worrying about your performance turns the body's emergency mode on. To reverse this, you must retrain your mind to stay present. Practical strategies include: stop the pre-flight check. Instead of evaluating your erection, focus on what feels pleasurable. Anticipate connection rather than testing yourself. If your mind starts to race, take a deep breath and return attention to your senses: how your partner's skin feels, how they smell and taste. Slow down if you feel yourself losing arousal. Slowing your movements and deepening your breathing signals safety to your nervous system. Enjoy kissing, touching, and sensual play to rebuild arousal. Speeding up increases adrenaline. Slowing down activates the parasympathetic response. Shift your focus away from whether you are hard enough. Notice the shared experience. Communication with your partner about what feels good fosters intimacy and reduces fear of failure. Mindfulness exercises such as body scans or guided imagery can train your brain to stay in the present. Address underlying stress. Psychological erectile dysfunction is often a sign of broader anxiety, depression, or relationship issues. Therapy or couples counseling can uncover root causes and teach coping skills. Maintain a healthy lifestyle. Adequate sleep, regular exercise, and a balanced diet support hormonal and vascular health, making erections more resilient. Avoiding excessive alcohol, tobacco, and recreational drugs will help preserve nerve and blood vessel function. If you notice persistent erection problems despite using these techniques, consult a healthcare professional. They can rule out hormonal or vascular issues and guide you to appropriate treatments. Remember, sexual performance is not a test. By breaking the anxiety cycle and focusing on connection, you give your body the best chance to respond naturally.